Our program is different than other programs in the respect that we have this family environment here that we're very proud of. We have a dedicated faculty. People will learn cardiology regardless of which fellowship they go to, so it ultimately comes down to who's the teacher and who's the learner. And that really sets us apart. We, as a community of cardiologists with our fellows, spend more time together than probably they spend or we spend with our families. We are dedicated, we are devoted. This really becomes our family, and we do anything and everything to make sure that our fellows are successful. And that at the core is what it means to me for us to have a family environment here. We have the most updated systems in our echo lab. We have the highest technology in our nuclear stress test labs. We do procedures here in our interventional cardiology lab that are done in just a few locations in the Northeast, including some structural heart procedures as well. So there's nothing that our patients have to seek from a major academic institution outside of Danbury, because we really offer everything here in one location. We are a multi-hospital system, and the truth is all of the resources of a large network are at our fingertips, both from an administration point of view, from a financial point of view, from a technology point of view, but we're still able to maintain the intimacy and the kind of small fellowship feel because our fellows stay at one hospital. Granted, we're a decent sized hospital. We're almost 400 medical surgical beds. We're a trauma center. We really see everything and anything. And again, the nice thing is that our fellows become a familiar face throughout the hospital. They're recognized by nurses and the house staff, both medical, surgical, OB, so on and so forth. So I think that it's really the best of both worlds. We have all these resources, but don't have to travel out to get access to it. We have a 100% board pass rate, which just confirms that people are learning the right material and are mastering that material and doing well. We have fellows who place in advanced fellowships across the country in some of the most prestigious programs. In addition, the remaining fellows who graduate go into academic practices or private practices all across the country and really have had the pick of their choice, so to speak, their dream job when they leave here. So we have really accomplished fellows when they leave here. It's a testimony to their dedication, the type of caliber of candidate that we bring in, and again, emphasizing the dedication and devotion of our faculty.
From the first day in the cath lab, I was allowed to help out and, scrub in and be right next to the attending and, be walked through the entire procedure. Learned a lot from the techs in the room too. Watched them set up the table. They explained to me how to use some of the equipment. So yeah, there's definitely a lot of hands-on and one-on-one learning with the attending.
It's really a good atmosphere to learn. You see a lot, and you kind of form bonds and relationships that are probably going to be lifelong. And anywhere you go, you're going to learn cardiology. So that's a fact. But here, you definitely, we're so small that you almost have no choice but to learn cardiology, but then you form these bonds and kind of you use that to grow yourself and become a better doctor and a better physician. So I definitely don't take it for granted.
It comes down to who's your teacher and who's going to share this wisdom and who's going to mold you into the person that you want to become. And I think that's what sets us apart. That's what makes this program unique and special and why someone should consider coming to Danbury.